If you suffer from aches and pains or have problems with arthritis, dry needling may be the solution for you. And I'm joined by Michelle here at Rehab Associates. We're talking about exactly what this is and how is this different than acupuncture?
Well, the first thing is that acupuncture uses and dry needling use the same needles. So they are acupuncture needles. It is dry needling because there is no liquid that goes into the surface. It is just a dry needle. Acupuncture was developed 2,000 to 3,000 years ago, and it is an ancient Chinese method that has not changed over the past 2,000 to 3,000 years. Now, the physician who decided to start the dry needling was an acupuncturist from China who came to the United States and became a physician and realized that the 2,000 to 3,000 year old method was ancient. He wanted to start treating musculoskeletal issues in the area that the musculoskeletal issue is. So dry needling uses more of the dry needle to reduce trigger points, knots in the muscles, arthritis, hip bursitis, things like that. And it's basically a technique that works very quickly, does not have to be done forever. It treats the problem and treats the problem consistently. Sometimes we treat athletes before their competitive event to place them in the best musculoskeletal issue and position that they can to compete significantly better.
And let's talk about what you do specifically. You treat certain areas, right?
Yes, I treat the musculoskeletal system, so I treat muscles and trigger points, but also have had quite a bit of success with treating knee osteoarthritis, hip bursitis, tennis elbow, any of those areas where you have itis in the joint.
Interesting. And I have Dr. Mike Richardson over here. He's going to kind of go through this whole situation with me. You tried it on me first, and tell me a little bit about why we do this and why it's good for folks and who might be available to do this. You know, what type of patients do you see?
So as Michelle said, we're looking at trigger points or knotted areas in the muscles, taut bands that cause pain and can refer pain. So those type of patients who have that deeper tightness in the muscles respond very well. So what we do is have the patient come in, we palpate that area, find the specific areas that are pain-provoking, and then that's where we put the needles.
Interesting. Now, why not just get massage? How is this different?
So the needling allows us to access deeper muscle tissue, like in the hip or the back. And even in the thigh, which we're going to show in just a second, we can get all the way down to the femur. So we can get to a deeper area faster without depressing all the tissue above it. So it's less painful, it's quicker, and therefore we get a faster response.
It seems like such a easy, thoughtful option. You know, are there any type of people out there, though, that that shouldn't have this done?
So the biggest issue is if you're on blood thinner or have some type of clotting disorder, that's a precaution. There are other minor things that we have to consider, as far as vascular conditions, but for the most part, the musculoskeletal system, if you have an issue, calf, shoulder, back, most anybody else can be treated.
So let's go through this with her and talk about your pain a little bit. You know, what kind of problems do you have?
So I am pretty athletic. I like to run and play soccer. So I get a lot of muscle soreness and pain in my quads and IT bands.
Gotcha.
So dry needling definitely helps with that.
I bet. Yeah. And so let's do this.
Okay. So for her, we've kind of checked her. We know she's got some tenderness kind of right down the middle, and we can feel that. So that's her vastus intermedius and her rectus femoris. So we'll put some alcohol on that just to clean the surface of the skin. And then I'll just mark her. And then these are single-use disposable needles. So once we put them in and take them out, we throw them away.
Gotcha.
The plastic goes right up against the skin.
Are there different lengths for different body parts?
Exactly. So as you can see here, this is a longer needle, so we might use that for the hip or the lower back. Depending on the girth of the muscle, which she has good muscle girth there, we could use a longer needle in that muscle as well. Yeah, so we put that up against the skin. These are snap tabs. Mm-hmm. So you can see it's just in the surface. And so this might be another difference too between acupuncture, is that we're going down into the muscle belly. Uh-huh. So the needle's going to go a little deeper.
She's not even flinching either. And the electrical stimulation you did in my shoulder, because I have problems sometimes from lifting and I get very sore, is this something you would do on any part with electrical stimulation as well?
Yes, you can. And what that allows us to do is to kind of cover a bigger area without doing as much pistoning. So you can either move the needle up and down to try to hit those target areas, taut bands in the muscle. But on some of the deeper muscles where it's harder to deflect the needle, because the needle does bend, you can see. Mm-hmm. What we'll do is put the needles in, and then we can use the electrical stimulation to kind of gap that area, so we can treat a bigger area at once with a little bit less manual movement of the needle in the patient.
So do we feel sore afterwards? I just had it done. I actually feel a little bit better. Do we feel sore later? How does this all work?
So it's typical to feel sore for about 24 hours after the treatment. Usually it's muscular soreness, like you've worked out. Mm-hmm. And then within a 24-hour period, typically the soreness fades away. The biggest thing I tell patients is to drink plenty of water. That helps to flush the tissue out. But you can take Advil, Tylenol, or use heat or ice.
Rehab Associates offers dry needling at several area locations. To find out more about this award-winning practice, give them a call at 855-RACV-4PT or go online to racva.com. And still to come, breaking down domestic violence, how it affects the family, and how to get out of this type of relationship. Expert advice after this.